Good evening. Welcome to Health is Wealth. This is Bernetta Pearson from the Chicago chapter of the National Black Nurses Association. And with me here in the studio on the phone is Miss Janice Henry. She will be answering your calls as you call us tonight with your questions, your information, things you need to know. The number's at the bottom of my screen, 312-738-1060. Okay, so jump in anytime. We are, as you know, the Chicago chapter of the National Black Nurses Association. So the majority of the shows that we do for you are centered around health and things that have to do with health. And as you know right now, we have so much to talk about in the coming months about the Affordable Health Care Plan or Obamacare or any of the names that people call this. And it is in danger of being extinct if the Republicans have their way about doing that. So most of the time when you turn your TV on, that is the talk of the day. Are we going to have health care, Obamacare, or not? Right now, it is still effective. You are still required to enroll in before, I believe it's the end of January, and have yourself insured. Now, I hear people talking pros and cons about that. So jump in anytime tonight and let me know your thoughts about getting rid of Obamacare or affordable health care. Pros or cons. Do you think we need it? Do we not? Can we do without it? Are there questions that you have about it? Have you registered or signed up? And as you know, I think one of the things that they're trying to do away with right now is the fine that you will get for enrolling late into the Affordable Health Care Plan. So as the months go on, we're starting a new year, a new president, a new problems, new thoughts, and we're just going to navigate this together. And the Chicago chapter of the National Black Nurses Association is going to be right with you as we go through these perilous times. We need health care. It's not something that we can do without. There are people who have a lot to say about it. Some who want to pay for it, some who don't, some who think we don't need it. And if the Republicans have their way, and we must be vigilant about that, we won't have it. And then we'll be right back where we started, before we had it. And in those times, if you remember them, if a person had, and let me talk about, I'll bring up one like Ebola. I remember when Ebola hit the United States. I remember when there was another communicable disease that hit the United States. Everybody was getting paranoid about, oh, am I sitting next to someone who has Ebola? Do they live in my neighborhood, in my community? Am I going to get it? But a lot of the times, people who did not have health care, and just imagine when you did not have it because you could not afford it, and things and people, let's say you sat down on the bus. The person next to you might have had Ebola or whatever disease of the day was out there, and they sat next to you, and maybe they had a communicable disease such as a respiratory disease, and they coughed. And when they coughed, they didn't cover their mouth. They just coughed. And then you look. But you never thought about that. Those who had health care in those times, they thought that they were really on it. I've got insurance. I'm okay. Whatever happens, I will be treated, etc., etc., etc. Well, the insurance that you had back in the day, the best that it could get you in terms of protection was maybe a private room where you wouldn't be in the bed next to whomever had what, or something to that effect. But with Obamacare, with the Affordable Care Act, you could almost be assured that most people now have insurance. That means that they do not have to choose between the money that it costs to see someone or paying the rent. And back in the day before affordable health care, that is exactly what we did. If we had money left over after paying all of our bills, maybe we could go to the doctor. Or Maybe we had a terrible cold or we were sick, but we couldn't go, but we'll go next week when we get paid. In the meantime, we couldn't take a day off work because you needed to work every day. Therefore, you took your communicable disease with you everywhere you went until you could go, until you got carried into the emergency room. I remember those days. Working in the hospitals, we came across a lot of that. So I will only tell you that the Affordable Health Care Act, for me, is the only thing in town at the moment that will help us stay healthy. You know, healthcare is undergoing a lot of changes. There are a lot of people who would like to see Obamacare, the Affordable Health Care Act, done away with. Just get rid of it. It costs too much. We don't need it. But what about the people? And I was looking at TV one day and I saw a gentleman say to our president, our new president, President Obama, I know I'm a Republican, but I have to tell you that I owe my very life to President Obama. And what did I say before? President Trump. I owe my life to President Obama. I had cancer, and I had insurance, the Affordable Health Care Act. And that's why I'm here now. And yes, I'm a Republican, and yes, I voted for you, but I'm letting you know. He said this to President Trump right there on the TV, that if it were not for President Obama and the Affordable Health Care Act, he wouldn't be here today. I don't think that touched our president very much, because as soon as he could, he was taking pen to paper to see what it was that he could eliminate from the Affordable Health Care Plan now, from the President Obama plan, or whatever they are calling it now. He has already signed away federal subsidies in terms of paying for abortions overseas. He's signed that away. And whatever other little things that he could find to sign away. But I've been told, and I have not seen this on the internet, if you have, please give us a call. Have the Republicans, and I was looking at the news earlier today and I didn't see it, so is it on the internet now that the Republicans have decided not to repeal the Affordable Health Care Act right now? Which everyone has been trying to tell them, you can't repeal it until you have something to replace it. And so far, we have nothing to replace it. And it took us forever to explain the Affordable Health Care Act to people. So what we need to do is, and this is going to be an endeavor that we're going to be bringing to you from time to time, in terms of the events that you need to know about around the Affordable Health Care Act. And whenever they come up with something to replace it, if they do, then we will bring that to you also. So I'm sure that ourselves and other healthcare groups will do that. So in the meantime, since it hasn't been repealed to my knowledge, I'm going to tell you that we're still signing people up. You still have until the end of January to sign up. And if you don't sign up, as far as I know right now, it is still a penalty if you do not sign up in the required time for that. So if you need health care insurance, you need to enroll today. I remember hearing President Trump talking about how he was going to keep two parts of the health care plan. He was going to keep the one where the children could stay on the parents' health care plan all the way up to, I believe it's age 27. He was in favor of that for the children. So I don't know where that went. I haven't heard him say anything about that in a while, but I'm listening and you listen. And then you call, let's share information. We all owe it to each other to stay on top of and abreast of what is happening with this healthcare plan. When you find out something, give us a call here and let us know. today I saw XYZ, or I heard XYZ, or I read XYZ, and I want to share it with the other people. We have got to be talking to each other now. It is so important just so we can stay on top. So, I have a flyer here that says if you need health insurance, you can enroll today. If you're looking to get it for the first time or change your existing insurance under the new Affordable Care Act, here is, please visit the Connie Lindsay Cancer Resource Center. And I think that I'm going to try and put it on the overhead so that you can get this information. If you have a pen and a paper, write it down. Let me pull it down a little bit so you can see it. Enroll today. Connie L. Lindsay Cancer Resource Center. It's located on the main level of the Loretto Hospital, which is on the west side of the city, which is where we are at the moment. It's on the main level of the hospital to explore your insurance options. You know, people still do not understand a lot of the ingredients in the Affordable Health Care Act, and so it will be really great to get here, and if you haven't, go by there. They have weekend enrollment, Saturday, January 28th. That's the weekend, and the weekday, January 30th and the 31st. You know, it's over at the end of January, and we're almost there. So you don't have any more time to think about it. You don't have any more time to see if our illustrious president, new president, is going to do something about it. You don't have time to do anything right now but get to this place either Saturday, January 28th, or the weekday, January 30th and 31st, 10 a.m. and 2 a.m. to sign up, because you do not want to pay that penalty. And I know that people resent the fact that if they don't sign up, they have to pay a penalty. But there's a reason why that's like that, because if they didn't put a penalty there, then a lot of people probably wouldn't sign up. And we need to have as many people as possible sign up so that we can afford the Affordable Health Care Act. That's what it's about. We have to have people who sign up, and if they don't, they have to pay the penalty. Now, you were asking for, audience, you were asking for insurance for pre-existing conditions. That was one of the biggest problems that we had, because who didn't have pre-existing conditions? Who didn't have, especially in the some groups, hypertension, diabetes, heart disease? You could just look around your house, wherever you are right now, your family, your friends, and you would find people who had pre-existing conditions. That is one of the biggest things that the Affordable Health Care contains. You needed to have that for yourself and your family. And so that's still there, and it's still waiting for you to do that. So you might say, well, I'm healthy, I'm feeling good, I don't need the insurance, I don't want to pay that money. I don't think I should pay just to take care of other people. But guess what? The way that people talk, it's like, if we don't have the Affordable Health Care Act, then we don't have to pay for these people. But you have been paying for uninsured people all the time. You were paying it through your taxes. It wasn't like I was not paying. You were. When they went to the emergency rooms and used them as a doctor's office because they couldn't afford to go to the doctor's office, we paid that. We were paying for it anyway, but now it's organized. Now people are being seen on a regular basis, so you don't let your diabetes get out of control. You don't let your hypertension get out of control. You're able, with this insurance, to go to the doctor anytime you feel like you need a refill, anytime you're not feeling well. You can get on top of it and stay on top of it. That will stop you from having to take days off work because you're sick, or being carried into the emergency room because you waited too long. All of those things, just think about them. And have a group, have a block club discussion, have a family discussion. Anything that you want to have so that we can work on this insurance act along with our President, Donald Trump, and the Republicans as they try to take it apart. We can work along with it, and perhaps we may be able to come up with a better solution. Who knows? So that is, and this show, time passes fast, but I really wanted to put it out there. I really wanted to tell you where you could go at this last minute to the Loretto Hospital, and it is on Central Avenue. Okay, Chicago, Illinois, 645 South Central Avenue. I'm putting it right here again so that you can see it. So please, take advantage of that. And we would like to see you there, taking care of the business. All right, we don't have much longer, so there's some other news that I want to put out there. And time is passing so fast, and our minds are in 50 different directions, yes, because there's so much going on with this presidency. But February, okay, where is it? February 24th. I want to tell you, next month, lest we forget, is Black Nurses Day. That is February 24th, and that's at the Apostolic Faith Church. That's 3800 South Indiana, 6 p.m. People always talk about all of the first responders, all of the people, the heroes that do things. Every now and then I hear about a nurse, and I heard about one last week, who was happening by as a person was having a heart attack, and she went right over and gave them CPR and until the ambulance could get there. I've heard of that happening on planes. I've heard of nurses being first responders. I've heard of them saving people. But we don't get much attention for that. We don't get the glory for that. We don't get the recognition for that. And we have a Nurses Day that comes once a year, and we don't get much of recognition for that. So I think it's about time that we step up and let you know that nurses are first responders. Nurses are people who save people. We are heroes and sheroes also. And so we're celebrating this. We celebrate it every year. This is February the 24th at Black Nurses Day, National Black Nurses Day, Apostolic Faith Church. That is 3800 South Indiana, 6 p.m. If you have a nurse in your family, if you know a nurse, if you just love nurses, the nurses that you had in the hospital were super. Make sure that you come out and help us to celebrate that. We would really, really like for you to do that. Okay, now, before I go off the air and time passes fast, I told you that, we need for you to, when you, where am I here? Okay, when you have questions, tune in here. We're here once a month. This is the new year. We will be here the fourth Tuesday of every month with information, health information, with questions, with answers to some of your problems or your requests or things like that. Write us in your book. Fourth Tuesday every month. And I am Bernetta Pearson. I'm your host. Also with me is Miss Janice Henry. She's on the phone when you call, or sometimes you'll even see her being the host of the show. But we are. And as time goes on, maybe you'll see other nurses who will volunteer, because that's what we do. And we owe that to the CAN TV, that under its auspices we're able to come to you and bring you information. And information is vital, especially now. If you haven't thought about tuning in to cable access, Chicago Cable Access before, you need to stay on it now. You need to let other people know, because this is one of the channels that you will find that will keep you up to date with different groups, with different purposes. We're all about you and making sure that you are up to date and that you stay healthy, and that the other groups and the problems and the thoughts that they sponsor are there. So we want you to tune in every day. How about that? That they have the different community groups and bringing you information. And it's a two-way thing, that because we have a phone that you can call us. You can ask questions. You can tell us what shows or what information that you would like for us to bring to you. You are controlling this. You're sitting here and you're watching us. But you also have the privilege of calling us and connecting with any of the groups and saying, I want to know where you're meeting, what are you doing, how can I help, etc., etc. So, I'm going to end on that note because our president will have me talking all night long, and I'm not going to do that. But next month, we will be right here for Tuesday. We will be bringing you up-to-date information on what is happening, because every day things are changing. Every single day with this new president. And so we're going to be on top when it comes to health care. That's our baby. So give us a call. Thank you so much for tuning in, and we will see you. Don't forget, I just gave you a place where you can go at the last minute and keep from having to pay that fine for not signing up for your health care. Thank you so much, and we'll see you right here next month. Oh, one more thing before I forget. Got 1 minute to tell you. Call us, 773-792-7222. Let me put that right there. Okay, no, I'll just do it. 773-792-7222. I hope you got that information. Next month, I will be better prepared. I've been off a few months, so I'm kind of whatever you want to say, but I'm going to get with the program. Thank you so much for tuning in. Have a great and a safe month until we see you again.